So this is week number 5 of 26 weeks of Miraculous Mondays or Management Mondays. Monday 31st Jan. देखते देखते साल शुरू हुआ and the first month is coming to an end. The second month begins tomorrow with a bang. The Union Budget 2022 would be presented and I'll be dissecting it minutely in my Thunder Thursday episode this week on 3rd of Feb at again same time 8:15, 8:20. So friends, welcome Philhal to the episode number 5 of Miraculous Mondays. And as usual, all my presentations will always begin with thanking Lord Almighty, who's given me much more than what I deserve. So this is my brief CV, since many of you are now aware of it, but still it is my duty to show you how I actually belong to this arena. So many of you actually ask me, where do I notify this? I notify this in my free WhatsApp groups, now running since almost exactly 4 years. Feb 2018 we started, and the Feb 2022 they'll complete 4 years of my own groups. Otherwise, the education online which I have been delivering is more than 5.5 years old, and of course totally free of cost. If you want to be added in these groups where we discuss only education and nothing else, it is a totally advertisement free group, please send me a message. So many of you are linked to my YouTube channel also. You come from there also. Do subscribe to my channel because it has more than 400 videos made for all of you. Started in the past, you can say July 2020 lockdown phase, and in 1.5 years we have reached this level where you can actually get benefited from this. So the topic for my session today is, why do patients bargain? Bargaining in dental clinics. What are the most common reasons other than the reason of typical Indian mentality? You would say, yes, Indians have a habit to do so. But then what are the other reasons you can think of? So to overcome bargaining, should I reduce my cost or inflate my charges and then show us 25% off? Is that legal, ethical, or whatever? So is bargaining related to patient satisfaction or more so after treatment? So these are a few topics that we'll be taking up in the next 15-20 minutes. Let's begin without much ado. So I think these topics would be perplexing for everyone. We all face this situation. Those of you especially who are in private practice, they are facing these things continually. So what exactly are the reasons? I believe that bargaining in any private setup, any clinic, is actually inversely proportional to patient satisfaction. So a famous Harvard professor has given a formula: S is equal to P minus E. Patient satisfaction is equal to patient perception minus patient expectation. The patient walks into your clinic with a certain expectation. What you do via your treatment, via your otherwise SAV and VSAV, I call it, via your treatment, and via your treatment means hospitality wise and your dental treatment wise, how you treat the patient, he forms a perception out of that. If the perception is more than the expectation that he had walked in, the resultant S would be positive, or else the S would be negative. S is equal to P minus E. Satisfaction, perception, and expectation. So the P has to be big for the S to be positive. P has to be bigger than E, expectation. So the commonest point is that satisfaction, I believe, is inversely proportional to that, the bargaining part. Usually the post-op treatment, especially we presume that the dentist has talked it out, has a written thing about the treatment charges, and everything has been mutually agreed upon terms. Still at the last stage, a bargaining kind of a situation happens. What do you think is the most common reason? We always say typical Indian mentality is one of the most common reasons. But there may be other few genuine reasons. Why do people respond to this? Need to put your thinking cap on and tell me the answer. Of course, this is not an interactive session, so I would give the answer myself over here. The biggest reason, as per me, is the cost versus the value. The patient is spending a certain cost in the treatment. If he does not get the desired value in the treatment you offer, the resultant P is equal to be lesser than the E. the perception will be lesser than the expectation, and the resultant S would be, or the degree of S or satisfaction would be negative. And I believe many times we feel that this might not be genuinely the reason, but then it is. We have to understand the difference between the cost and the value. So the cost of your service is something you spend to produce, or you can say offer a service or produce a service, you can say. The price is your financial reward for providing that service. And value is what your patient believes the product or service is worth to them in that case. So these are the broad differences between the cost and the value. So somewhere, somehow, the difference is not established and the patient feels that the cost he has paid for is not justified. बहुत लोगों को ऐसे लगता है कि अगर if we are spending ₹10, they should get back at least 11 or 10 and a half. But even if they get 9 or 9.5 out of 10 rupees they have spent with you, just as an example, they will feel dissatisfied. Such is the human mind. We always want more than what we spend. And that is the point you need to ponder upon. I always believe for any calculation of your cost, always add profit in your calculation, in your basic cost. Already we are not calculating the cost properly. We just look at the direct cost. We totally ignore the indirect cost, the hidden cost, and the remaining 16 types of cost, which I've given you in my previous costing videos in depth. So we're already ignoring that. So always try to add those costs at least to your profit. Even if you are a beginner, even you are just into your practice, you need to add that. That cost can be 10, 20, 30, whatever margin percentage wise you want to add as your fixed profit, so that you are in green zone from day number one. That is the primary, you can say, rule of any business. Don't wait for the hatti chatti vatti theory, as it is famous in my native land, that for the first few months, you can say, eat from your pocket, then break even, and then start earning. That is a theory of the past. That originated from coal economics theory in the 1840s or 50s. How did it came to dentistry? I don't know. But then treat profit like a fixed cost or a loan payment EMI or salary or wages, whatever it is. Don't just look at breaking even in the initial stages of your practice. Because you need to remember, you don't have to recover your costs alone. You have to recover your value also, your skill and worth. And that is worth pure gold. Somebody who just sees the direct cost, I just make him remind, go back to your final year, remember the kind of hard work we have put in, and then decide what are you going to charge. I have always believed, and I proudly say, that BDS UG final year is one of the toughest curriculums in India. And actually, you can say tougher than even the final year MBBS, I would say. We have so many subjects, plus the practical work, the credits required, plus all that to be done in 9 to 10 months, practically less than a year. And it is so much stressful. Agar aap apna wo time bhul gaye hain, so whatever you want to charge, you can. But if you have not forgotten that time, you need to remember that you need to add the profit from in your costing from day one. Don't give the excuse that I'm a beginner, I am a learner, I am just a starter in the practice. No, that is not an excuse. So if I've set your mind thinking in that regard, you need to think yourself. So again, when you are thinking of the profitability part, you have to realize what are the benefits your patients are gaining from your services. Is it a need service or is it a want service? The needs are the ones which are urgent in nature. Any pain, swelling, discharge, that is a need. But any whitening, any zirconias, any smile designing, any similar structures are never needs, they are wants. So we should not be actually compromising on the cost part. Some people sell those things like onions. You need to really introspect what you are doing. So then after the benefits, because whatever you charge them, they are going to flaunt it for a higher price. For example, if you charge for zirconia for X the amount, they are going to flaunt it for 2X the amount. Then the criterion our patients have chosen to select us. word of mouth referral, convenience, or reliability, or whatever factor. Then the third factor is the value. What value our patients place on receiving the benefits that we provide. So wherever possible, always set the prices that reflect the value you provide and not just the cost. Because cost puri karna is just a myth. You need to add, and what cost you look at is usually the direct cost. You don't even look at the indirect or the hidden costs. So you need to understand that the value that you are providing to your patients is worth pure gold. And that is where we usually falter. So I hope I have put you in a think mode somewhat. So before I go to the carry home Gyaan, let me just go back to that slide of initial, you can say, question, which I posed over there. Sorry to put that slide not at the back end. I forgot to do so. I'm sorry. So why do patients bargain? It is the typical Indian mentality reason, yes, but the biggest reason as per me is the cost versus the value. If they don't feel that the value that you have given them is worth the cost they have spent for, they will tend to bargain, even if there are mutually agreed upon terms in the beginning. They might still pay up in the end, they might still cough up the amount in the end, but there'll be a bitter relationship, a bad blood kind of a thing, and the patient will go to never come back to you in future if that is the case, if you have really been guilty of providing a bad service. Then to overcome bargaining, should I reduce or inflate my charges and then show us 25% off? Two parts in this. Legally, ethically, you are a dentist and you don't need to stoop so low to provide a off kind of a thing. Number one. Number two, internally, whatever you want to do, you are free to do. Of course, the law doesn't stop you from internally. You are not supposed to project this in the outside market. You can do internally whatever you are. What anybody is doing, nobody knows in their setup. But then remember this thing, cost and price standardization, the price standardization is one thing which I believe should be there in every clinic. And one should not be charging a different price from one patient and a different price from another patient. I've seen many a time people charging more from NRI patients, lesser from Indian patients, and even lesser from maybe a class 3 or a class 4 patient, a sweeper or a mali or a, you can say whatever. So out of your personal empathy, whatever you want to reduce, you can, but do not charge separately. I personally believe it is unethical, although there is nothing unlawful regarding this to charge more from the NRI patients and less from the Indian counterparts. I believe NRIs are also Indian patients only. They are non-resident Indians, but they still are Indians. Very few of us have actually the foreigners visiting us for treatment. Yes, they used to in the pre-COVID era, but in today's times, hardly any. So is bargaining related to patient satisfaction? More so after the treatment? Extremely, yes, a big yes. As I said, the S is equal to P minus E comes into 4. The satisfaction is equal to perception minus expectation. So as I finish answering these questions, let me give you the carry home Gyaan, which I usually give at the end of my presentations as usually, so as to summarize everything that you have to actually take home. So I always believe, do not reduce the cost, always increase the value. Always give a increased value in the form of a better service and you can say a comforting one to the patient, at least you can say a physically appealing and a visually pleasing part, you would say. And of course, those who see just the price will never see the value, and those who see just the value will never see the price. That is always going to be there. Bargaining फिर भी चलती रहेगी. I always say this to my workshop participants that whenever the patient has to choose you, price is a criteria. It may be a top 5, one of the top 5 reasons to choose you, especially if it is a big ticket case or a medium ticket case, also in cost value, I mean to say. But if you have to pick out the top 3 factors for the patient choosing you as their primary dentist, the costing or the pricing will never feature in that. That means the patient has ignored the pricing part to pick you as their primary dentist. So if the patient has done so, you need to remember that the service equivalent component is to be given by you. I hope I have vehemently conveyed my point. Bargaining फिर भी चलती रहेगी, वो चलती रही है, चलती रहेगी. There will be some, you can say, bad elements in that regard who will continue to do that, and there will be people who will be actually pressurized to actually stoop to lower prices, or you can say forced to accept lower prices. So I hope this sets the mind in a thinking direction for all of you. So Baba Ji ki sadai jai, as I always say in the Chapnam series that I share from MX Player hit show Ashram. So thank you so much for watching this. So I hope you have liked today's episode. So this is my social media presence by my name only, and the WhatsApp group intimation. If you need to be added, just message me, I'll add you. This is my, again, social media presence by my name. And please do send me your valuable feedback on my number, on the Facebook group where you're watching, or in the Facebook group where I'll be sharing it, or on the YouTube channel where it will be shared later. Bouquets and brick bash both would be welcome in equal measure. Thank you so much. And I stopped my share to just go back to my page to see where people are watching this. Okay. Hello, Vinita ma'am. Good evening. Hello, Ramchandra sir. Good evening. Hello, Dr. Surinder Lodha. Good evening. Hello, Rajiv sir. Good evening. How are you? So, friends, as I told you, this is episode number 5 of Miraculous Mondays. Episode 5 of Thunderous Thursdays would be back on, would be there on Thursday, 3rd of Feb. And in this episode, I'll be dissecting the Union Budget 2022, which is going to be presented tomorrow in the Parliament by our Honorable Finance Minister, Ms. Nirmala Sitharaman. So stay tuned. Please do watch Thunder Thursdays and the next episode of Miraculous Mondays. Till then, bye-bye. Take care. Have a great weekend. Have a great week ahead. Sorry, the weekend just finished. I'm sorry.